welcome back. We're looking a little bit further onto the core and now onto the hip. So previous video we've looked at is finding the foundation, the stability. So you found that neutral pelvis. So go back to that neutral pelvis for me. You might want to put your fingers onto your hips there. Now it's really, really important here that you're not forcing yourself into neutral. Neutral should be that middle ground. So Goldilocks and the Three Bears, the porridge was too cold, the porridge was too hot. We're looking for that balance in between, right? And kind of in our lives, we're always looking for that balance point. This is very, very, very exemplified when we're looking at neutral pelvis, okay? What we want to do here is bring the knees to hip distance apart. Commonly what people will do is they will force their knees together to fix. Where you don't have stability in your abdominals or in your glutes, you'll force your knees together to try and fix and to get stability. What we're trying to do here is we're trying to really get the glutes active. So you should feel your glutes, the butt cheek muscles, okay? Heels a little bit closer for me, because what we want is we want your heels directly below your knee. Because what we're going to do now from neutral pelvis, we're now going to go into bridge. So you're going to squeeze butt cheeks, push your pelvis up towards the ceiling for me. Good. And now
keep my hands here.
Yep, just so you can find, because sometimes what people will do is when they come up, then they'll lose neutral pelvis. It's a really, really common thing, okay? So see, can you try and get that back a little bit, of tilting the pelvis back a tiny bit in this position. Does that make sense? It's tricky, right?
Which is back.
Which is back, yeah, this is really super common. People will be very strong, very stable, and very able. When they come up here, now they're like, what's happening? I don't know where that is again. So try and let this drop. Can I put my hands on you?
Yeah.
So try and let this drop back. Does that make sense?
Yes.
So you're engaging more. And now what's happening is rectus abdominis. It's a geeky word for your six-pack muscle. That's the muscle which is going from your pelvis down here up to your ribs, okay? That actually there is now really working to get you into your neutral pelvis, okay?
That feels really nice actually.
Yeah, this is a really, really nice exercise because you're engaging the core. Now this is actually more effective at engaging that six-pack muscle than crunches, right? Or sit-ups, because that's all that hip flexors, okay? We'll go into a different video about that. What I want to look at now is single leg bridge, okay? So first of all, do you feel your glutes working?
Yes.
Brilliant. Great.
Yes.
Excellent. That's really important, okay? Because commonly we're dominant on the quads, okay? There's a section in the book talking about the dominance of the quads with dominant muscles. This is really common that we're using these muscles. We want to feel the glutes working.
I can feel a bit on my lower back.
I feel a little on your lower back. Now, can you try and tilt a bit more away from that? So you can try and spread a little bit more, give some gaps, some space.
Like that?
Does that feel right?
Yeah.
Good. Okay. Single leg bridge. We're going to straighten this leg here, but you're really going to have to engage and squeeze through the right-hand side. Great. Where do you feel working now?
Glutes.
Which one?
This one.
The right one.
Yes.
So the one which is connected to the earth, okay? So your right heel connected to the ground, running through now into that right hip, that's really supporting you.
Yeah.
Because this one can't be supporting you, yeah? Notice how you're dipping down a little bit?
Yeah.
Because it's fatiguing, it's getting tired, and that's really, really normal, real natural. Try for me bringing that knee down, because what you can do is if you look along this line, and we'll reshoot this so you get to look, notice how that hip there is dipping down.
Yeah.
Can you feel that?
Yeah.
Put your hands back on there. Yeah.
Oh yeah.
Yeah, so that's dipping down. Now what this guy here needs to do, he needs to tighten up and rotate. So he needs to engage. Yeah, this is tricky. Again, we're getting the brain to think to bring that up. Well done.
Okay.
So you're using now side arse. Okay? Does that make sense? You're using that hip there to rotate to bring this up and bring that stable. You getting tired?
No. Yeah.
It's okay if you are.
Concentrating.
You're concentrating, yeah. And this is an exercise for the brain as much as it is for the body, because we want the brain to use the muscles in a different pattern. It's the whole reason we're doing this. We want to repattern. It's not about making you really tired and fatigued and sweating, but it's about making you feel into which muscles am I using, how am I using them, can I use them a slightly different way. Make sense?
Mm-hmm.
Good. Now, switch over for me. Brilliant. Try and align that knee back down again. Great. Now notice what happens when you do that.
Got wobbly.
Got wobbly? Yep. You want to bring your knees together because you're looking for stability in there. That's fine. And that right side here is dipping down. Does that make sense? Can you feel that?
Now we're aligned.
Now you're aligning. You probably see that On the camera, that's kind of dipping up and down, kind of this direction, right? Because what's happening is this muscle here, in our modern bodies, we don't use that side of our hip to correct the hip. And again, this is back to abdominals and hips working together. We don't use that hip to maintain the stability of the pelvis, because that's a really important pelvic stability muscle, but it's in our glute, it's in our butt cheek, okay? So we have to switch that back on, raise that back up. Cool. Breathe, bring that back down. Good. Feeling okay?
I actually feel a bit at the back of my thighs.
Yeah.
Is that normal?
Yeah, that is normal. Brilliant, thanks for bringing that up, because commonly what will happen is hamstrings will want to kick in and they'll want to work.
Yeah.
Now, the way to get around this is try to bring that heel a little bit closer. So let's bring this one down again. Okay? Try to bring that heel closer to you. Closer, closer, closer. Good, that's it.
Both
Now,
heels?
yep, that's fine. Now try again, up into bridge.
This way? Oh, bridge.
Yep, good. Now try and straighten that one there again. So you're using that left one again. Do you feel it in the hamstring as much now?
No.
No, good. It's a really common one what will happen. Now, there's maybe quite a bit, some people at home, some other therapists or exercise people might say there's a lot of shear force coming through that knee now because it's not at 90. So there is an argument to say that we shouldn't have a lot of shear force. And in the world we're talking about squatting and not squatting, we might have a lot of shear force, but what we're helping to do is to switch off the hamstring so we're not getting that dominance happening. Okay, ready for a
How much
rest?
should you hold that for in general?
Till you get tired, till that butt cheek gets tired. Great question, very, very relevant. Very different for all people. Sometimes you might need to make the exercises more challenging so you get tired quicker. But what your most important thing you need to worry about is that there, yeah. Do you notice how that drops down? You need that hip, the side of that glute to be strong, to be active, to have endurance. Okay? Happy?
Yep.
Relax down for me. After you've done this exercise, the most important thing to do now is relax, lie down flat. Pelvis come back to neutral.
That feels nice.
That feels nice, yeah, because we've given the muscles around the hips a bit of a activation and we can deactivate through the core. Welcome back again to a progression of the glute bridge. What I've got now is a band between the knees, or around the knees, sorry. You can use a stretchy band. If you don't have one of these, they're really easy to get a hold of. But if you don't have one, you can use a belt, you can use a piece of rope, or my favorite is the belt off your dressing gown. You can use anything just to give you some feeling of when you bring your knees away out, you can feel the resistance. Can you feel that? Good. Now what's going to help you with is switch those glutes on the outside of the hips. So when you bridge up, brilliant. Can you feel a difference here where you're putting the knees out? Can you feel the glutes switching on?
Yeah, I actually feel it from my hips as well. Is that normal?
Yep.
Okay.
Everything's valid as long as it's not sore, right?
Okay. Yeah.
Yep. So what I'm going to try now again is tilting that new pelvis back a little bit. So you're engaging with the glutes more. You're switching the glutes on
This way,
again.
this way.
So you feel it.
Yeah.
Good. Excellent. Good. Now try again for me, straightening one knee. Excellent. Good. Now I'll put the camera around this way so you guys at home are able to see now that left hip dropping down. Can you see that along this line? And the reason why I say to keep your knees straight is if you look down, you can see that dropping down, right? And you can feel that with your feet. Yes, exactly. Hopefully you saw that from home. What we want here is we don't want to be perfect. Perfect is an illusion. That's something which mind has created. We're not looking for perfect. What we're looking for is when you catch yourself dipping down, we want that now to strengthen on the other side. Do you want to swap over and try that on the other side? Great, excellent. Stretching out to the band. So you're using, now this side has to work harder now, yep, because it has to resist the pull from the other side. Good. Now, do you notice that right hip now has dropped down?
Yep.
Can you squeeze? Yes. So you're bringing that back up to be level. And this is really functional now, because on your bike or running or walking, this is functional, because we want that hip to be working with rotation as well as extension.